a real area of development is to say, okay, so we've just talked about high risk as one end of the spectrum. The other end of the spectrum is low bulk, well-performing, early stages of disease. And so what we've learned about cancer in the last 20 to 30 years is if you treat early, you treat aggressively to minimal residual disease states, that you do well, and that some people under those circumstances can be cured. The current problem is that when we look at early disease stages, we don't know if they're going to behave stably for years and don't need anything, or whether they're going to progress rapidly to myeloma. So kind of where we are with this is it's an important approach. We have definitions, and we can now really focus our attention on splitting early disease stages according to their genetics. And we've just had a paper published with a Belgian group with Benedict Oden and Francesco Maura that aims to separate smoldering myeloma. But instead of separating smoldering myeloma, what it turned out was that there seems to be one set of diseases that is genomically bland and stays stable more or less permanently and is not in need of early interventions. Whereas if you have the feature of myeloma, these so-called myeloma defining events, then it's almost inevitable that you will develop myeloma at some stage. So why not treat early, intervene, and stop the development of the disease so that patients never develop myeloma at all and have a life that isn't bothered by the end organ damage and the pain and anemia and fatigue that's associated with active myeloma and what it does to your body. So intervention strategies look like a serious way forward. But when you choose an intervention strategy early in the disease, you don't want it so mild that it generates drug resistance, and you don't want it so strong that it causes damage in the tumor cells or in the microenvironment and increases your risk of therapy-related AML. And so what we think is that these new immune-based therapies that fix the immune system are ideal for this setting. So as long as they don't have side effects, use the immune system, induce deep responses, then the anticipation is that patients will be cured. And this is going to be, one of the big sites where we will actually see cures instead of waiting until people inevitably develop clinically aggressive disease. So I'm very hopeful for this in the future. And, the companies are really starting to pay attention to this kind of approach. And I think it will make a difference. And it's what I think patients should be demanding really is prevention rather than cure when, by some definitions, cure is impossible.